I'm Susan Gerard, and I'm the President and CEO of the Mississippi Children's Museum. We are so grateful to all the children around our state who have sent us their questions, who've either called us or sent us a video of their questions, and Dr. Didion is here today to answer those questions.
Well, thank you, Susan, for inviting me, and I'm so very excited to be here answering these questions at the Children's Museum. And my name is Lisa Didion. I'm a pediatric hospitalist and the Associate Chief Medical Officer at Children's of Mississippi, which is part of University of Mississippi Medical Center.
So let's get started.
My name is Trent. I am from Meridian, Mississippi. I am 8 years old, and I have a question about the virus. Why does it hurt people so badly?
It's a great question, Trent. Nobody likes to see any of their family or friends in pain or hurting or sick. This virus, what happens is the virus infects or gets inside of our cells within our body. And this virus particularly does that in areas that are important for our breathing. So our nose, our lungs, okay? And when a virus infects parts of our lungs, it causes lots of inflammation. And inflammation is the body's response to infection. And that's what causes us to cough, to sneeze, maybe you get a sore throat, and most importantly, you often get a fever. So every virus acts differently, and this coronavirus, it likes to infect our lungs. Can't tell you exactly why this virus likes our lungs, but it does.
My name is Clark. I live in Meridian, Mississippi. Can kids get the virus? And why can't we go out as much as we used to?
Hey Clark, yes, kids can get the coronavirus, although most children that have gotten this virus have not been very sick. Most children just get a little cough and a runny nose, maybe a sore throat and some fever. Generally, they do not get as sick as maybe your grandparents would or some older adults that live in the neighborhood.
Hi, my name is Mayland. I live in Meridian, Mississippi. I am 10 years old, and my question is, how does the coronavirus affect your body?
Hey Mayland, it's nice to see you and get your questions. So the coronavirus affects the body by really causing 4 main symptoms: fever, cough, sore throat, and shortness of breath. Sometimes shortness of breath really comes about when we're exercising or you're doing something that takes a lot of energy. But when sometimes you get sick, particularly with this virus, you may feel short of breath even if you're just sitting down. And that's very, very different. So those are the main things that your body will feel with this virus.
Hi, my name is Cadence Bradley. I'm 7 years old. I'm from Meridian, Mississippi, and my question is, how long is quarantine going to last?
Hey Cadence, I think that's the $1 million question. And I don't know the answer to it right now. And I think it all depends on how we look at the information we have on a daily basis. Right now, scientists and researchers and the leaders of our great nation are looking at all kinds of data on a daily basis. They're looking at how many cases we have in each state, how many cases we have as a country, what is going on in other countries. And with that data, that's how they're going to decide when we can relax our quarantine. We don't have an exact date right now. We're crossing our fingers it will be sometime this summer, but we don't know. And the best thing we can do is listen to those experts. They have our health and well-being in mind, and they want us as a country to get over this as fast as we can too.
Hi, my name is Hallie. I'm 9 years old. Now I'm in Meridian. My question about coronavirus is, how long does it affect you?
So most people that have gotten the coronavirus have been sick somewhere between 7 to 10 days. It varies for every single person. Some people have been sick up to 14 days, but I would say on average it's been about 7 to 10 days.
Hi, I'm Hamilton Carr. I'm 12 years old and I'm from Meridian, Mississippi. My question for the doctor is, if you're asymptomatic, is it dangerous to have the coronavirus?
Hey Hamilton, that's a great question. And I'm going to answer that yes, it is dangerous if you're asymptomatic. Not particularly to you personally, but maybe to your grandparents or your neighbors who are a little bit older, because we know that this virus can be much harder on an older adult than it is on children. So that is why right now you'll see a lot of adults walking around with masks when you go to the grocery store or anything. And that the whole idea behind the mask is that if I'm asymptomatic, that I'm not spreading any of my respiratory particles out in the air. It's keeping those around me safe. So that's why the social distancing and keeping 6 feet apart from each other is also very important.
Hi, my name is Andrew Carr. Yeah, I'm 11 years old in Meridian, Mississippi. Yeah, I have a question. Can dogs get the coronavirus?
Hey, Andrew. Thankfully, right now, there's no evidence that dogs can get coronavirus. There's actually not a whole lot of evidence that any domesticated pets have gotten coronavirus. Many children may have seen that there was a tiger in a zoo, I believe in New York State, that might have had coronavirus, but that is our only known case here in the United States of an animal or a pet.
Does it hurt us?
Hi, Lyra. Great question. So the coronavirus hurts us because, as I said earlier, it infects our good cells in our body and makes those cells not work the way they should. And what happens with that, particularly with this virus, is it makes us have a really bad cough and feel really short of breath and have a fever. This virus is particularly hard on the human body because it's a new virus to us. Our bodies have never ever seen this virus. And so it takes our bodies a little bit longer to fight it and to fight it correctly and to recover from it.
Thank you so much, Lisa, for being here and for answering all of our questions, the children's questions, and I know many adults want to know the answers as well. So thank you so much for your time.
You're welcome. All great questions. Keep them coming. I'm happy to answer some more later.